So I want to get through a lot here, but one of the things we've noticed is this new COVID variant that seems to be circulating in Asia. I believe it's NB 1.8.1. It's a variant under monitoring. What do we need to know?
Yeah, so this appears to be a subvariant of JN1, which has been the dominant strain. So it's believed that there is cross-immunity protection. The COVID virus is going to continue to mutate, and it's behaving like a common cold virus. It's now going to become the fifth coronavirus that's seasonal, that causes about 25% of the cases of the common cold.
So you're thinking of it as like a flu-type variant, just a normal fluctuation?
The flu mutates about 34 times more frequently than COVID. The COVID variant mutation rate appears to be a little more stable, but the international bodies that have provided some guidance on which strain to target have suggested that either JN1 or any of these subvariants would be reasonable strains to target.
So you don't seem overly concerned about that. I want to get now into some of the recommendations that have been very specific this week from the CDC and you with the HHS secretary in this video announcement on Tuesday, where Secretary Kennedy said the CDC was removing the COVID vaccine for healthy children and healthy pregnant women from its recommended immunization schedule. He then had a memo to the CDC rescinding recommendations for kids' vaccines, saying the known risks do not outweigh the benefits. Then late Thursday, the CDC said, quote, shared clinical decision making, which I think is just talking to your doctor,
yes,
should determine whether kids get vaccinated. Can you clearly state what the policy is? Because this is confusing.
Yeah, we believe the recommendation should be with the patient and their doctor. So we're going to get away from these blanket recommendations in healthy young Americans because we don't want to see, on the COVID vaccine schedule, we don't want to see kids kicked out of school because a 12-year-old girl is not getting her fifth COVID booster shot. We don't see the data there to support a young, healthy child getting a repeat infinite annual COVID vaccine. There's a theory that we should sort of blindly approve the new COVID boosters in young, healthy kids every year in perpetuity, and a young girl born today should get 80 COVID mRNA shots or other COVID shots in her average lifespan. Mm-hmm. We're saying that's a theory, and we'd like to check in and get some randomized controlled data. It's been about 4 years since the original randomized trials. Mm-hmm. So we'd like an evidence-based approach. Dr. Prasad and I published this in the New England Journal of Medicine last week, and we're basically saying we'd like to bring some confidence back to the public around this repeat booster strategy theory, because
your statement was not about repeat boosters. It says the vaccine is not recommended for pregnant women. The vaccine is not recommended for healthy children. That's different than annual boosters.
Yeah, at this point, we're dealing, it is a booster strategy. People would be getting the updated shot. So whether or not a young, healthy
kids who haven't gotten
so we'd like to see the data. We'd love to see that data
but on a
doesn't
practical
exist.
level, for a parent at home hearing you and trying to make sense
We're
here.
saying take it back to your doctor.
If their child has not been vaccinated, are you recommending that their first encounter with COVID be an actual infection?
We're not going to push the COVID shot in young, healthy kids without any clinical trial data supporting it. That is a decision between a parent and their doctor. And just so, I don't know if you know these statistics, but for 88% of American kids, their parents have said no to the COVID shot last season. So the vast majority of Americans are saying no. Maybe they want to see some clinical data as well. Maybe they have concerns about the safety.
I don't want to crowdsource my health guidance. I want a clear thing, right? You don't go with popularity. You go with, as you're saying, data. And when we look
so
at
let's see the data.
Okay, so the CDC data said 41% of children aged 6 months to 17 years hospitalized with COVID between 2022 and 2024 did not have a known underlying condition. In other words, they looked healthy. And COVID was serious for them.
So first of all, we know the CDC data is contaminated with a lot of false positives from incidental positive COVID tests with routine testing of every kid that walks in the hospital. When I go to the ICU, when I walk to we know that data historically under the Biden administration did not distinguish being sick from COVID or an incidental positive COVID test. When you go to an ICU in America and you ask how many people are in the ICU that are healthy, that are sick with COVID, the answer I get again and again is we haven't seen that in a year or years. And so the worst thing you can do in public health is to put out an absolute universal recommendation in young, healthy kids. And the vast majority of Americans are saying, no, we want to see some data. And you say, forget about the data, just get it anyway.
Here's the story, ladies and gentlemen. The Daily Mail's got it. Kash Patel, FBI director, announces COVID breakthrough after seizing Anthony Fauci's phones and hard drives. This is actually pretty crazy. The Trump administration has recovered a cell phone and hard drives used by Fauci during the COVID pandemic. Speaking Thursday on the Joe Rogan Experience, FBI Director Kash Patel described the discovery as a great breakthrough in the government's ongoing investigation into the origins of the pandemic and the federal response. Patel said investigators had long struggled to locate the devices Fauci used while serving as chief medical advisor to the White House, records that could shed light on key decisions surrounding lockdowns, mask mandates, and ties between Fauci's former agency and the Wuhan laboratory central to the lab leak theory. He did say, for all we know, he's deleted everything. We don't know. He says, we found it. And at least we can tell the American people we've been looking because it is of public importance to figure out, did that guy lie? Did he intentionally mislead the world and cause countless deaths? We owe those answers to the American people. And the best evidence ever is always the people's evidence who created it. So now we're going to go and exploit those hard drives. He says, we did find it. We are not done. We're still looking and we're on the case. And that being said, Fauci's got a universal pardon. Mm-hmm. He was pardoned for a period of 11 years, I think. So if they actually want to go after Fauci beyond this, if they actually want to charge or imprison him, Trump already did declare the pardons void, but the DOJ is going to have to file a suit. It's going to go to the Supreme Court. Then what?
Yeah. It's where the auto pen question is actually really important, because if I assume the administration's argument is going to be, well, it was the auto pen. He did all these pardons aren't actually real. It wasn't even him doing it. He couldn't know, etc. So that will be like the whole thing will hinge on whether or not that actually, is found to be legal by SCOTUS.
I think the question that's always stood out to me as most important is if they're our biggest adversary, China, and for whatever reason, Dr. Fauci, USAID, and everyone was creating bioweapons in a lab in China with our biggest adversary, and it leaked. These seem to be bigger crimes than just the pardon and all of that. I don't understand why that's not treason, or they're not our biggest adversary. So why are they working on bioweapons in China in this lab that had a lot of problems already? So to me, the questions about Fauci are less about, did he lie about the lab leak, and more about why was America working with the Chinese Communist Party to create bioweapons to begin with? That should matter to Americans more than anything else.
While it was banned.
Yeah.
Yeah. Well, isn't it always that they say we create the new bioweapons so that we can create cures for them, which is
that's the argument.
Yeah, that's the argument.
It's like the nuclear weapon.
Every time you've heard that, you're like, that doesn't make any sense.
We make nuclear weapons so that we can create the repairs for the devastation that nuclear weapons cause.
Welcome to China in Focus. I'm Tiffany Meyer. Our top story. China's health authorities reporting the country has hit its first COVID-19 peak this year. People on the ground are reporting severe symptoms, even deaths, including among medical workers. We're closely watching a sharp rise in COVID-19 infections in China. On Thursday, China CDC reported the country has reached its highest COVID-19 infection level so far this year, with cases steadily rising since March. At the same time, doctors in several major cities are telling us a concerning development. Multiple medical workers have died after contracting the virus. It's worth noting that the Chinese regime has a track record of underreporting COVID-19 cases and deaths. Here's what we know so far. Official numbers from China are often criticized for underreporting the true scale of the outbreak. But this rare admission has already sparked a wave of discussion online. On Chinese social media, users are sharing their own COVID-19 symptoms, including fever and intense sore throats. Some also report noticing a rise in local deaths, but official data remains limited. Here's what one resident from Jilin in northeastern China told us.
Lately, quite a few people have died, several just in the past couple of days. Some were elderly, some were young. One of the older ones actually seemed full of energy, always out for walks in the mornings. That person died before even making it to the hospital.
Zooming in on southern China, Li, a resident from Guangzhou, told us that he and his family members have contracted COVID-19 multiple times. But that's not all. Recent media reports and online obituaries suggest that several doctors in the region have passed away, most of them in their 50s. Official statements attribute these deaths to overwork, but provide few details. NTD cannot independently verify the circumstances surrounding these incidents. One doctor told us authorities may be trying to suppress information about these deaths.
There are doctors at top-tier hospitals in Guangzhou who have died. The Health Bureau told us there's no need to report it. Just focus on disinfection, wearing masks, and washing hands.
This doctor also told us about an elderly doctor who recently passed away just 2 days after being diagnosed with COVID-19 after showing severe symptoms. He added that the majority of patients visiting his hospital are showing cold and fever symptoms. However, many prefer not to take a COVID-19 test to save money, and hospitals are not enforcing strict testing protocols. According to the doctor, this approach is intended to avoid causing panic if test results reveal a serious outbreak. Zooming out, according to China CDC, the latest COVID-19 surge in the country is being driven by a new variant called MB181, also known as NIMBUS. The WHO is keeping a close eye on this variant due to its increasing global presence and potential implications for public health. We'll keep you updated as the situation develops.
Why do they keep calling it long COVID? How come nobody I know who wasn't vaccinated got long COVID?
Right.
What is this long COVID you speak of? Is there long flu? Where's the long pneumonia? What the fuck are you talking about? Why are you calling it? Is it possible that this is a vaccine injury? I'm just asking.
Well, yeah, I've been looking at antibody levels in these people, and it's alarming. So we really don't have a lot of tests for vaccine injured. It's hard because they'll get the $1 million workup. By the time they come to see me, they've gone through, multiple tests. They have multiple doctors.
It's not really $1 million, is it? The workup?
Well, I don't know, but I'm exaggerating. But
right. I just want to be clear.
I don't. It could be.
For some Vanity Fair came
exactly.
Horst Dewormer, who claimed there was $1 million markup.
Somebody should fact check me on that, and it's probably higher than $1 million, but. So they go through the workup, and then they can't find a test to prove that they're injured. So the doctors will put them on psychiatric medication. They'll put them on sleeping pills and benzodiazepines and antidepressants. Literally, I saw a patient was put on all three. So the only test that I have found that does seem to correlate is this antibody test. It's a spike protein antibody test. LabCorp has it. That's where I send people. Quest has it, but they put the upper limit as too low, so you don't really get a good sense. But the upper limit of the test is 25,000. And people that have not gotten the COVID shots, I'd say it's usually under 1,000. And then people that have gotten the shots, a lot of them are off the chart. They're over 25,000. But on average, they're probably 10 times higher than the people that have not gotten the shot. And this is people who they were vaccinated 4 years ago. It wasn't like they just got the shot. Obviously, COVID's not an issue anymore in terms of, people getting sick. But 4 years later, you should not have sky-high antibody levels. And that's what I'm seeing. And that is alarming. It just suggests that there is a lot of spike protein still in the body causing problems.
And haven't they shown that the spike protein continues to be produced in the body up to 700 days later?
Yes. That's one study. There's some, what's interesting in that study, the antibody levels were really low, which doesn't make sense. So I kind of questioned the whole study, but yeah, I see it. I see patients. I still see vaccine injured patients coming to me for the first time years later. Last week, I probably saw 6 new vaccine injured patients, and they're not getting any help. The government, it's called the CICP. It's a countermeasures injury compensation program. They're supposed to help these patients. They have denied 98% of people that have applied for assistance. They, on average, I think they've awarded 30 people, 30 of all the vaccine injured that have applied, 30 people on average, the award is like $4,000 for these people. It's horrible. I mean, these people's lives are just destroyed. These are not easy things to treat. It's not like I can give them an antibiotic and they're good to go and they're fine. I mean, they're very challenging. We don't have a lot of guidance. I do see a lot of success with ivermectin, but it's slow going. It's usually months of trying to help them. And the government really needs to help these people because there's a lot of people suffering. And they're getting completely ignored. The other issues, we don't even have a code. So every disease has a numerical code, and it's called an ICD-10 code. It's what they use to compensate people for, or the insurance companies use them, but also for tracking. So if you have, COVID has its own little code, and you can just dial in the code and get all the numbers. They don't have a code for vaccine injury. They have a code for vaccine hesitancy, but they don't have a code for injury. So all these people are just sort of, they're getting all these diagnoses, but there's no way to track them. It's a big problem.
How convenient.
Yeah.
What's very shocking to me is when I talk to people that are pro-vaccine, still pro-vaccine, and when I be very specific, mRNA vaccine, still pro-COVID vaccine, that will tell me they don't know anybody who was injured by it.
Yeah.
I was like, how is that possible?
How many people do you know?
I know a lot.
Yeah.
I know 2 people on pacemakers.
Yeah.
2. And they're young people.
Everybody knows somebody.
Yeah, I know a lot of people that got fucked up, including family members. I know a lot of people that got fucked up. And people that don't want to admit they got fucked up, all of a sudden they have this new cancer that's spreading, like, rapidly.
Yep.
It's terrifying.
China's COVID-19 outbreaks are intensifying, and the virus has now reached the United States. The U.S. CDC has detected multiple cases of China's new COVID-19 variant, NB1A1, at major airports. Infections have been found in travelers arriving in California, Washington State, Virginia, and New York City. Zooming in on China, China's CDC recently admitted that COVID-19 infection rates hit their highest level since July 2023. Here's what Chinese doctors and citizens are sharing with us. To protect their identities, we have distorted their voices.
Given the nature of the current infectious outbreaks, I fear it could become quite severe in June and July. I believe there's a possibility of explosive growth. Most patients don't get better for months. The illness just keeps going.
The virus is flaring up again. I believe it never really stopped.
Earlier this
month, China's CDC reported over 440,000 new COVID-19 cases in May, including more than 600 severe cases and 7 deaths. It's important to note that the Chinese regime has a history of underreporting data related to outbreaks. On Monday, a citizen captured photos of health monitoring teams back on a highway in Xinjiang. These teams, nicknamed Big White, were common during China's COVID peak in 2020. In southern China's Guangzhou city, a third grader's parents received a notice last month requiring a week-long home quarantine after a positive COVID-19 test. Zooming out, many in China have told NTD they're seeing a rise in COVID-19 cases around them, with some developing pneumonia and even dying suddenly. They also report that hospitals are under strict orders to conceal the outbreak.
The outbreaks are quite severe in southern China. In Shenzhen, many hospitals and clinics have long lines. They all have sore throats and fevers. Official reports say this is a new variant of COVID. But even if someone dies from this illness, the Chinese regime won't tell you that they died of this illness.
Chinese media have reported a rise in sudden deaths among the country's young elites, including professors, scholars, police officers, and internet influencers. Many were only in their 30s or 40s. In nearly all cases, no cause of death was given. Even inside the regime's top political circles, 2 senior state-level officials died last week with no official explanation.
Because testing would cause panic. Once people start dying, everyone gets scared. Now, some local health bureaus are telling us there's no need to report cases.
The lack of transparency is fueling growing concern that China's COVID-19 crisis could have global implications. Both the World Health Organization and the U.S. CDC say they are closely monitoring the situation.
Hey there, everybody. The newest COVID-19 variant on the rise now has a nickname of NIMBUS. It comes from the NB.1.8.1 subvariant of Omicron. It is spreading rapidly, and it appears to stick to our cells and infect them really well, which means you may want to be on the lookout for a few nasty symptoms. The main one reported right here, a hoarse voice and a wicked sore throat, said to feel kind of like a razor blade sensation, according to symptom trackers. Infectious disease specialist Dr. Stephen Blatt of Ohio's TriHealth told me lots of us don't associate a sore throat with this virus. So since this might be your first noticeable symptom, remember this.
For those people who are at risk, the virus hasn't gone away and they still have to respect it.
This NIMBUS subvariant also seems to be causing a second unusual COVID-related symptom, GI troubles. Nausea, vomiting, diarrhea, all common. But with this one, bloating, constipation, heartburn, and stomach pain are also being reported. The usual COVID-19 symptoms, such as coughing, sneezing, and respiratory problems, also still present. These, Dr. Blatt says, are the ones bringing people into the intensive care unit, especially if they have pre-existing health problems.
Sometimes just really older patients, because they lose their immunity with time. As you get older, you just don't build antibodies as well as you used to.
And speaking of immunity, if you have had the most current COVID-19 vaccine or you've previously been infected with the virus, you likely do have some immunity to NIMBUS. While it's more contagious than some other subvariants, it is not causing, in most cases, more severe disease.
I'm deeply troubled, however, by so many things happening at HHS under your leadership, especially your ill-informed decision to reverse existing recommendations for pregnant women and healthy children to receive the COVID-19 vaccine. The chair of the American Academy of Pediatrics Committee on Infectious Diseases described your decision as really concerning and taking away choice. The American College of Obstetricians and Gynecologists and the March of Dimes have also opposed your decision. Chairman, I have two items to insert into the record. ACOG's statement on HHS recommendations regarding the COVID-19 vaccine during pregnancy, or the COVID vaccine during pregnancy, and also RFK Jr. says COVID shots no longer recommended for kids and pregnant women.
Without objection.
Thank you. Due to my limited time, I ask that you please respond to my questions with a yes or no. Mrs. Secretary, does HHS COVID-19 vaccine webpage reflect the department's view on COVID-19 vaccines? Yes or no?
First of all, what you said was wrong. We're not depriving anybody of choice. If a pregnant woman wants the COVID-19 vaccine, she can get it. We're no longer recommending it because there was no science supporting that recommendation. There's study after study that shows adverse events. One study, 27 adverse events during pregnancy from that campaign.
I'm going to interrupt you because I need to reclaim my
Another
time.
study shows an increase in miscarriage. There's no safety data for it, so we're not going to recommend it.
Not true.
We don't have safety data.
We have a pediatrician that is on this committee. Not true.
The FDA is expanding its current warnings on two leading COVID vaccines. It's about a rare heart side effect that's usually seen in young men. This is called myocarditis. It's a mild heart inflammation. Complications came after both Moderna and Pfizer shots became available. The FDA sent letters to both companies to update and widen their warnings.
Let's talk about some of your latest health headlines. We're looking at a new COVID variant. People say feels like a razor blade pain in your throat. Doesn't sound pleasant. We've also got the latest on the measles cases.
Yeah, never good. Athena Kehoe joins us now in the studio with what you need to know. Athena, it sounds like staying healthy right now is critical.
That's right, and this new COVID variant is called NIMBUS, and many people know it as the disease that makes your throat feel like you're swallowing razor blades, which is not a very comforting thought. I spoke to Lindsay Kohler, who is an epidemiology division manager with the University of Arizona, to find out how concerning this is. She says this variant has been found in Region 9, which includes Arizona, but so far it hasn't been detected in Pima County.
It's very similar to what we've been seeing. We don't have any
reason to think that it's more severe than the previous variants. And so the course of healing would be similar to what we've seen in the past, maybe up to a week or so of not feeling great. So if you have that cough, congestion, fever, stay home if you're not feeling well.
If you have summer plans, Kohler says it's a good idea to make sure you and your family are up to date with immunizations before traveling.
So the new CDC vaccine panel has released its first recommendations, including yearly flu shots for everyone 6 months or older. Flu vaccines, though, without the preservative thimerosal.
Thimerosal, yeah.
Thimerosal,
Yep.
okay. Here to talk more about this is Dr. Todd Ellerin, Vice Chair of the Department of Medicine at South Shore Health. Always good to see you. I think this is important because let's start with these recommendations. In addition to the guidance on flu shots, the panel also recommended that RSV shot for newborns. Let's talk about what really came out of this and what does this mean?
Right. There were 3 votes.
Okay.
And the first one you already said in the fall, flu shots for 6 months and older. So nothing changed there.
So that wasn't shocking,
and that's
or
good news.
there was nothing.
That's
okay.
right. Then this new, really a second to the market RSV monoclonal antibody, similar to a vaccine, but not exactly, given to basically all children 8 months and under, and it's called Influenza, and that's just good news. Why? Because RSV is one of the major causes of infant hospitalization that first year, and this really will decrease that. So that's good news. But then there was some controversy over the group recommending that they remove thimerosal, which is a preservative, from multi-dose vials of influenza vaccine.
So let's drill down on that. There was concern over that, and that's why that's gone. Take us through it. What is this tied to? What is the concern? What do you think about this?
Right. Way back when, there was a concern that thimerosal, because it contains mercury, may lead to developmental delay in children. Okay, that's been debunked. There was controversy back then. Could it cause autism? And basically, all of the studies have shown that thimerosal does not cause autism. But because there was all this controversy, the government, the CDC, and other American Academy of Pediatrics recommended removing thimerosal from most vaccines. So most childhood vaccines don't have it. Multi-dose vials of flu shots do, but remember, only 3% or so of children actually are getting the flu shot with those multi-dose vials. So it's a small percentage.
That's interesting. Good perspective and good context. What's the point of this advisory committee?
Right. So why do we need an advisory committee? The FDA tells us who we can give vaccines or medications to. The advisory committee in the past has told us who we should give it to. And then insurance companies have tended to look for the formal guidance from the advisory committee, and then they start to cover the vaccines based on that.
Okay, is there any difference between the CDC's recommendations and the vaccine schedule of the American Academy of Pediatrics?
I'm glad you asked that question, okay? Why? Because remember, there are also academies. For instance, the Academy of Pediatrics actually has vaccine schedules just like the advisory committee does. I'm going to show you one slight difference, okay? The Advisory Committee on Immunization Practices currently made a change and says COVID vaccines for healthy children and healthy adults should be discussed with the provider. Whereas the American Academy of Pediatrics says healthy children, as long as you're 6 months and older, should get the COVID vaccine every year. It's a slight difference, but just showing you that there's more than one perspective. Now remember, importantly, both groups are saying that compromised children should get vaccinated every year, and that's important.
You've disconnected from the hive mind. Explain.